Otto Warburg and Himalayan Qigong. Episode 3, Scientific Proof and Practical Methods. Hello, welcome back. We've been through 2 episodes, and now you know. Otto Warburg spent his life studying the flame within cells. He discovered cells need oxygen to stay healthy. The Himalayan masters practiced for thousands of years. They taught the body needs vital energy, and vital energy is oxygen. 2 paths, 1 truth. But now, the most important question. All right, we understand. Cells need oxygen. Deep breathing brings oxygen in. So, does it really work? What exactly has science proven? And more importantly, how do we practice correctly? This 3rd episode will dive into reality. From laboratory to daily life, let's begin. Evidence from cells. 2021, India. A research group conducting a special experiment. They took patients with rheumatoid arthritis, an autoimmune disease. The body attacks itself, painful joints, swelling, difficulty moving, and they divided them into 2 groups. Group 1, normal medical treatment. Group 2, medical treatment plus yoga and pranayama. Deep breathing, every day. After 8 weeks, they took blood samples, examined cells, looked at mitochondria, and they saw something amazing. In the deep breathing group, mitochondria were healthier. Not a feeling, not a guess, but measurable. Mitochondrial integrity increased. Mitochondrial copy number increased. Energy production function improved. Warburg would smile seeing these results because this is exactly what he believed his whole life. Keep mitochondria healthy with oxygen. But that was just the beginning. 2022, a small study in the US. They found people who had never meditated, never breathed deeply regularly. They taught these people to breathe deeply 10 minutes daily, combined with mindful relaxation, just 8 weeks. After that, they took blood samples, analyzed genes, and they discovered the activated genes had 3 main effects. 1, improved mitochondrial performance. 2, increased insulin production, better blood sugar control. 3, protected telomeres. Do you know what telomeres are? Imagine your chromosomes are shoelaces. At both ends of the lace, there's a small plastic cap protecting it, keeping the lace from fraying. Telomeres are that cap. They protect your DNA. Each time a cell divides, telomeres shorten a bit. When telomeres get too short, cells age, stop dividing, or die. Long telomeres, you're younger at the cellular level. Short telomeres, you age faster. And the study showed, just 8 weeks of deep breathing, protected telomeres. This isn't mysticism, this is pure genetics. You're slowing down cellular aging through breath. Evidence from the brain. But perhaps the most impressive evidence comes from the brain. 2022, Thailand. A study on meditation. They found ordinary people, work stress, anxiety, fatigue, like most of us. They taught these people to join a short meditation retreat. Weekend, just 2 days. Combined deep breathing and mindfulness. Before the course, they took blood, measured BDNF levels. After the course, took blood again, measured again, and BDNF increased. BDNF, brain-derived neurotrophic factor, brain nerve growth factor. This is a miraculous protein. What does it do? It helps create new neural connections. When you learn something, you need BDNF. It protects neurons from damage, like a shield. It improves memory, helps you remember longer, more clearly. It fights depression. Depressed people often have low BDNF levels. And how can you increase BDNF? Exercise, running, gym, sleep enough, eat healthy food, and breathe deeply. Just 2 days, 1 weekend, already seeing effects. Imagine if you did this every day, 3 months, 6 months, 1 year. How would your brain be different? Evidence from cardiovascular system. 2022, a large study synthesizing many previous studies on pranayama. They reviewed dozens of studies, thousands of participants. The question, does deep breathing affect cardiovascular health? The answer, yes, very clearly. Blood pressure decreased, not just a little, but significantly. In people with hypertension, pranayama significantly reduced systolic blood pressure. One study even showed 1 hour of yoga daily was as effective as blood pressure medication, not replacing medication, but strong support. Heart rate slowed down. When you breathe deeply, you activate the parasympathetic nervous system, the relaxation system. This system tells the heart, slow down, more steady. The heart doesn't have to work overtime. It gets rest, even while still beating. Anxiety decreased, especially in cardiovascular patients. They often worry about their condition, fear the next heart attack. Deep breathing helps them calm down, less anxious, live better. Evidence from the immune system. 2024. The COVID pandemic had passed, but the after-effects remained. A study with healthcare workers, frontline workers, extreme stress, fatigue, anxiety, fear. They divided into 2 groups. Group 1, nothing special. Group 2, practiced pranayama. 4 weeks. After 4 weeks, they measured stress levels, measured quality of life, and the pranayama group, stress decreased significantly. Psychological quality of life improved noticeably. But there's more. Other studies show yoga and deep breathing strengthen immunity, increased gene transcription related to immune homeostasis, reduced chronic inflammation, helped the body fight disease better. The Himalayan masters have a saying, when vital energy is abundant, evil energy cannot invade. Science now says, when oxygen is sufficient, immunity is strong, disease struggles to enter, same meaning. 2 languages. But don't misunderstand hearing this. You might think, wow, deep breathing cures everything? No. Listen clearly to this. Deep breathing does not cure cancer. Deep breathing does not replace chemotherapy, does not replace radiation, does not replace surgery. If you have cancer, see a doctor, follow medical treatment. Warburg believed lack of oxygen causes cancer. He was wrong. Gene mutations are the main cause. But deep breathing can support cancer patients, reduce anxiety, reduce stress, improve sleep, reduce fatigue. This has been proven. Many studies. But it's supplementary, not replacement. Deep breathing does not alkalize the body. This is a dangerous misunderstanding. Many people think cancer lives in acidic environments, so alkalize the body. Cancer will die. Completely wrong. Your blood pH is always stable. 7.35 to 7.45, slightly alkaline. You cannot change blood pH by eating or drinking, or breathing. The buffer system in the body is extremely strong. It keeps pH stable. If pH changes by just 0.1, you'll be seriously ill. Need emergency care. The British Medical Journal in 2016 concluded clearly, there is no scientific evidence supporting the use of alkaline diet to prevent or treat cancer. None. So don't waste money on alkaline water. Alkalizing foods, or any products promising to alkalize the body to cure disease. So what does deep breathing really do? All right, if deep breathing doesn't cure cancer, doesn't alkalize the body, what does it do? Let's be clear. Deep breathing is prevention, not cure. It keeps your cells well nourished, mitochondria functioning efficiently, brain healthy, immune system strong. When the body is healthy, disease risk decreases, not never sick, but less often, milder, faster recovery. Deep breathing is the foundation of healthy living, like eating healthy. Regular exercise, adequate sleep, stress reduction, all work together, creating a system, not one single miracle, but a combination of many good things. Deep breathing changes how the body functions at a fundamental level. More oxygen to cells, mitochondria work better, energy increases, nervous system balanced, less stress, less anxiety, better sleep, brain nourished, BDNF increases, better focus, better memory, stronger immunity, less inflammation, body fights disease better. These are what science has proven, clearly, measurably. Now, how? So you want to start. You want to breathe deeply, correctly? How? Don't worry, I'll guide you, step by step. First, understand the golden rule. Start slowly, don't rush. Listen to your body. If dizzy, stop. Consistency matters more than intensity. 5 minutes daily for 3 months is better than 30 minutes once then quitting. Be patient. Effects don't come immediately, but they will come. Exercise 1. Snow Mountain Center Breathing. This is the most basic exercise, most important, foundation of everything. How? Sit down, chair or floor, back straight, but not tense, comfortable. Put one hand on chest, one hand on lower belly, 3 fingers below navel. This is the Snow Mountain Center. Close your eyes, or look down. Focus on the belly. Now, inhale through nose. Slow, deep. Inhale as if you're pulling air down to the lower belly, not chest. Feel the hand on belly lift up. Belly expands like a balloon. Hand on chest barely moves. Count in your head. 1, 2, 3, 4. Hold briefly, 1 second. Then exhale, through mouth or through nose. Your choice. Exhale slower than inhaling. 6, 7, 8 seconds. Feel the belly deflate, like a balloon releasing air. That's 1 cycle. Do 21 times. Traditional number in Himalayan Qigong. About 10 minutes. When? Morning. When stomach is empty. Before breakfast. This is the best time. Body is awakening. Air is fresh. But if morning doesn't work, evening is fine too. What matters is consistency. Exercise 2, 478, breathing. This is a quick stress relief exercise. When you're anxious, when you're tense, when you can't sleep. Dr. Andrew Weil from Harvard popularized this technique, based on ancient pranayama. How? Sit comfortably, back straight. Place tip of tongue behind upper front teeth. Keep it there throughout. Exhale all air through mouth. Sound like whoosh, all air out. Now close mouth. Inhale through nose. Silently. Count 4. 1, 2, 3, 4. Hold breath. Count 7. 1, 2, 3, 4, 5, 6, 7. Exhale through mouth. Sound whoosh. Count 8. 1, 2, 3, 4, 5, 6, 7, 8. That's 1 cycle. Do 4 cycles. That's all. Not many, but effective. Why does it work? Because when you exhale longer than inhaling, you activate the parasympathetic nervous system, the relaxation system. Body receives signal. It's safe now. Relax. Heart slows down. Blood pressure drops. Tension melts away. When to use? Before sleep. Helps fall asleep faster. When anxious? Before a presentation. Important interview. When angry? Before saying something you might regret. 4, 7, 8. Remember this number. It will help you. Now exercise 3, combining with movement. Deep breathing is good, but combined with movement, much better. Here are simple ways. Morning walk combined with deep breathing. Go outside, 6 o'clock, 7 o'clock, when the sun just rises. Walk slowly, don't hurry, don't run, and breathe with your steps. Inhale, 4 steps, exhale, 6 steps, or inhale, 3 steps, exhale, 5 steps. Whatever your rhythm, the miracle here is you're doing 3 things at once. Movement, good for cardiovascular, good for joints. Deep breathing, good for brain, good for cells. Sunlight, vitamin D, good for mood. 3-in-1, 3 times effective. Yoga combined with breathing. If you like yoga, wonderful. Each yoga pose has its own breathing rhythm. Learn from a good teacher. Yoga isn't just bending the body, it's combining body and breath. When done right, very powerful effect. Safety notes. Before finishing, some important safety points. Don't breathe too hard, too fast. If you breathe too hard, you might get dizzy, because CO2 in blood drops suddenly. If dizzy, stop. Breathe normally. Wait until dizziness passes, then continue, more gently. People with serious cardiovascular problems, ask doctor first. Gentle diaphragmatic breathing is usually safe, but some strong breathing techniques aren't suitable for everyone. If you have heart disease, very high blood pressure, or just had surgery, consult doctor before starting. Pregnant women, breathe gently. Gentle diaphragmatic breathing is very good for pregnant mothers. Reduces stress, improves sleep, but avoid strong breathing techniques or holding breath too long. Baby's safety is priority number 1. Beginners, take it slow. Start with 5 minutes. After 1 week, increase to 7 minutes, then 10 minutes. Don't force it. Don't compete with anyone. This isn't a race. Listen to your body. It will tell you. The greatest lesson. Warburg spent 40 years with microscopes, studying cells, studying mitochondria. He discovered cells need oxygen. The Himalayan masters spent thousands of years on snow mountains, practicing, meditating. They discovered the body needs vital energy. And now, modern science has proven oxygen nourishes mitochondria. Mitochondria create energy. Energy is life. Deep breathing brings more oxygen in, nourishes the brain, protects the heart, strengthens immunity, slows aging, all measured, all proven, with rigorous science. But the greatest lesson isn't about oxygen, or mitochondria, or BDNF. The greatest lesson is, health begins with the simplest things. Breath, always available, free, within you. You don't need expensive machines. Don't need miracle drugs. Don't need complex equipment. Just breath. Done correctly. Regularly. Persistently. End of episode 3. So that's the end of episode 3. We've seen scientific evidence from cells, from brain, from cardiovascular system, from immune system. We've clarified dangerous misunderstandings. Deep breathing doesn't cure cancer, doesn't alkalize the body, but it's the foundation of health. We've learned how to practice. Snow Mountain Center breathing, 4-7-8 breathing, combining with movement, and we've learned safety notes. Start slowly. Listen to your body. But the story isn't over yet. In episode 4, the final episode, we'll close this journey. What is Warburg's legacy? What's the path forward for Himalayan Qigong to the world? And most importantly, how to make what you've learned part of life. Not just 3 months, but for life. See you again in the final episode. And starting today, begin. 5 minutes, every morning. Sit down, put hand on belly, and breathe. 37 trillion cells are waiting for you to nourish them. Warburg spent his life understanding them. The Himalayan masters spent thousands of years practicing for them. Now it's your turn. Breathe deeply. The flames are waiting. See you soon. End of episode 3.